Hey guys, 2 nights in a row. It's Julie again from Fundamentals Physio and Wellness Clinic, talking on behalf of our group, educating you, our community, on things that happen to you and why they happen. So I am downstairs in my basement. The kids are asleep. I was just on Instagram and accidentally showed everybody my messy basement. So this time I actually put it on correctly. So this evening we wanted to kind of talk to you guys about basically neck pain, why we get neck pain, and kind of educate you on how your neck moves so that when you do experience pain the next time, that you are kind of a little bit more knowledgeable on why it happens, and you can be aware of what to do and that sort of thing when it does come up the next time. So a lot of us do experience neck pain depending on whether or not if you sit at a desk all day, or if you have any like a heavy lifting type of job, or if you spend your day kind of down with your head flexed, or let's say you're an electrician and you're doing a lot of pot lights and your head's overhead. So we all experience neck pain at some point or another. Sometimes it can be long-standing for months or years on end. And some of us can have more of an acute episode where you sleep funny and you get a little kink in your neck where you feel like it's thrown out for a week and you have trouble turning, checking your blind spot, things like that. So this episode or workshop is just kind of about educating you on your neck and why you get pain, and basically how your neck moves. It's a really simple concept if somebody breaks it down for you. So that's my goal tonight, is to teach you guys how to learn about your neck. So in the clinic, we usually see a variety of neck patients, and it can range from patients with just centralized neck pain in the back of the neck, or more referred pain into the side of the neck or into the trap region, or we can have some patients with radicular pain. Radicular pain just means pain that's radiating. Usually it's related to a nerve, or you can have, if there's a muscle issue, that can refer a little bit, but usually if it's all the way down the arm, a majority of the time it's nerve. We as therapists just have to decipher why it's happening, why the nerve is getting pinched, so that we can kind of, in basic terms, unpinch it or desensitize it. We see motor vehicle accidents, so if you get a whiplash or you get a concussion related symptoms if you're playing a sport and you hit your head, or we see even some little kids and babies with a torticollis, with a twisted or tilted neck due to muscular imbalances. So we see a variety of different things. So if you guys are watching this and you do experience neck pain or have experienced neck pain in the past, I'd like you just to put a heart so that we know kind of who and how many people have watched who actually are suffering from neck pain. Or if you know somebody who is or has suffered from neck pain and you think this video would be beneficial for them, please feel free to tag them in the video, or you can share it to their Facebook page, or you can share it on your page, so that we can kind of reach out to those people who are having issues and hopefully help them. So when we assess patients, I usually kind of put them in a different category. We can have a patient with a neck dominant pain, which basically just means pain that's in and around the neck. So by neck dominant, I mean centralized pain off to the side, usually not past the shoulder. And then I have patients who are more like arm dominant pain, which is usually those radicular pain symptoms where something's pinched and they're getting the symptoms all the way down the arm. So I kind of categorize them in those two kind of categories, but the reasons and their contributing factors can be very, very different. So my goal is tonight to show you how your neck moves, so that you can understand what happens. Because I feel like as soon as people understand how their neck moves and why it moves the way that it does, it's like a light bulb goes off in their head, and they're like, I didn't realize that, and it makes so much sense. So if you guys know me, I love whiteboards. I use whiteboards for all my patients. I'm a visual learner. I always had a hard time in school because everything was out of books, and when I would read text and read concepts, I had a really hard time understanding it. So I'm gonna break it down so that you guys can kind of see and understand exactly how your neck moves, what it does, and so that you can understand it just like I can. So I'm gonna move this down here. See if you can see me. Okay, so here's my famous whiteboard. If you've been in our clinic before, you will know that we have whiteboards in all the rooms. So that if we do need to educate patients, then we have that possibility to do so. So in our neck, we basically have our head, right? So this is the base of our head. We call it our occiput. It approximately, it's pretty variable with people, but it can range from 9, 10, 11, 12, 13 maybe pounds. So this is basically your occiput. Underneath your occiput, you have 7 cervical vertebrae. Okay? So you have 7 cervical vertebrae, and they all move a certain amount, okay? So your first and your second vertebrae, so these two right up here, these are extremely, extremely important, okay? They have a huge effect on the neck, okay? And now if you picture your vertebrae are stacked on top of one another, right? So when you look down, when you look up, each vertebrae is supposed to move on one another, okay? And they're supposed to rotate on one another. They're supposed to bend on one another. So I'm gonna give you guys an example of a patient that I saw a couple weeks ago. She had radicular pain down her arm into her fingers. And it was roughly C5, C6 area, which is basically in between the 5th and the 6th vertebrae. So she kind of had, it was kind of moving around. So when I assessed her, what we were looking at was where her movement was restricted, what was missing, okay? So your first 2 vertebrae on top of your head, we call that your upper cervical spine, okay? And then the rest of the vertebrae are your lower. So this is your upper, okay? Your upper cervical spine does a majority of your flexion and extension. So when you look down to the ground and when you look up to the ceiling, 50% of that movement occurs right here. So on C1, which is your first vertebrae, on your occiput. The rest of down here does the other 50%, okay? So if you're somebody who has a really stiff kind of extension, so you have a really hard time looking up to the ceiling, what we have to determine as physios is where is that restriction occurring? Is it occurring in the lower aspect or the upper aspect? So this lady came in, and when I assessed her, we kind of looked at her rotation. And her rotation to the right, she literally had half of her range, okay? So with her rotation, about 45 to 50 degrees of your rotation, so when you turn your head to the right, 50 degrees of that, we have about 90, maybe 100, depending on your range. 50 degrees of that occurs at C1 and C2, only at that level, okay? The rest of the vertebrae allow for that other 50%. So only 2 bones, basically the joints between 2 of these bones, take up half of your rotation. So can you imagine if these muscles and the bones and the articulations, the joints were stuck? So let's say I assessed that range and she actually couldn't turn her head if I specifically looked at that one level. Where else is she gonna move? So let's say she has no range there. It's just kind of stuck, and that's what we see. Sometimes it just gets stuck. Lubrication's down, the muscles are tight, that sort of thing. She was overcompensating below here. So she was causing a little irritation in where these nerves come out. So these vertebrae basically a joint, if you guys have never been told what a joint is, the bottom of one bone meets the top of another bone. That's called a joint. So every bottom meets a top, every bottom meets a top, every bottom meets a top. The nerves come out through these little foramens, and there's supposed to be a good amount of space for those nerves to run through. But if things are stuck and things aren't quite moving the way that they should, those nerves can get caught. And if you think of a nerve, think of it being the size of a piece of yarn, and the piece of yarn going through a hole. If that piece of yarn is swollen and irritated, it takes up more space. So that's why you get that referral pain down into the shoulder or down into the arm, because usually the nerve is irritated, it's swollen, because it's getting stuck, okay? So this lady came in, we checked her upper neck movement. So basically I checked her head on her first vertebrae. It wasn't moving very good. And then I checked her head and her C1 on her second vertebrae. So I specifically looked at both. She had no rotation at that level. So she was getting hyper mobility, so kind of compensating for that lack of movement up here, down through here. So she was getting this nerve really irritated. So it was going from the size of a piece of yarn probably to really, really thick and really, really irritated, and she was getting that constant nerve pain down the arm. So what we talked about, I kind of drew this diagram, explained to her what was going on, and we checked her movement to see kind of what her directional preference is. Usually when people have pain, they have if it's a mechanical pain, meaning something's stuck, something's not moving properly, you have what we call a directional preference. One movement that actually makes them feel good versus one movement that makes them feel worse. So as therapists, when we do our virtual visits, what we're looking for is what is your directional preference and what actually helps with your baseline pain. So everybody has a baseline pain, right? You're sitting there, you have like a 2 out of 10 pain, you have a 5 out of 10 pain. What we're looking for is what actually helps improve or reduce your baseline pain. Okay? So I checked a couple of different movements with her. I checked her flexion, I checked her retraction, I checked her rotation. She actually really responded to retractions. So she was somebody who sat at a desk all day. She was kind of like protracted for long periods of time. She said she didn't get up for breaks. So we kind of we tried a couple of basic retractions and sitting, and then I had her lay down at home on her bed, and she did a couple of retractions on her bed. And when she sat up and we checked her rotation again, it was actually better. And then I said to her, okay, get a tennis ball. And I showed her how to do this tennis ball release in the back of her head, right at the base of this occiput. And she said, well, why am I going to do that? And I said, well, you have these little tiny, tiny, tiny muscles at the base of your neck. Okay? And her neck pain was kind of around that area as it radiated down the arm. So you have these suboccipitals. Sub means under. Occiput's just the base of your head. So you have these little tiny muscles underneath. They go from your occiput to your first vertebrae, occiput to second vertebrae, and then you have a couple more going out to these joints here. If those muscles are restricted and they're really tight, they're not going to let those vertebrae move as smoothly as they should. So I said, grab your tennis ball, lay down on your bed, do this little tiny mobilization, this little stretching technique to the base of your head. So as soon as she did the chin tucks, she did a little tennis ball release, and we rechecked her range of motion. She had 3/4, almost full rotation. And now I said to her, what's your baseline pain? And she said, actually, it's only like a 1 out of 10, which is amazing. So it went from I think she started off with like a 6 or a 7 out of 10. And her pain was less down the arm. So she didn't have it into the fingers anymore. It was actually only coming to the elbow. So her pain was actually what we call centralizing. So coming more up towards the center and the base of her neck. So it was retracting back up instead of being all the way down into her fingers. So what we have to remember with the neck, posture does have a big part, but sometimes we can actually get restrictions in the bony movements. And as therapists, our goal when we do our virtual visits or in session, our goal is to figure out why you have that restriction. Is it a bony restriction, meaning a joint? So joints are supposed to slide and glide on one another. So when you turn your head to the left, it's supposed to slide like this. When you slide your head to the right, it's supposed to slide like this. When you look down, it's supposed to slide like this. If it's not moving properly, you get pain, right? You may get pain, or you may get radicular pain. And if it's not moving properly, we need to encourage that sliding and gliding movement of your vertebrae. We also have to look at, is there a muscular component? Is the muscles tight around that area? Because if the muscles are tight, it can kind of shift things. It can cause tension. It can perhaps not let that joint glide as much as it should. Our bodies are supposed to move. I've told you guys that over and over and over. Our joints are supposed to glide. Anybody here have neck pain right now? Hey, Jagpreet. Yeah, our lumbar spine workshop is coming up in, I believe, the next week or so. So tonight's session is mainly on cervical spine, which is neck-related pain, and referral to pain down the upper extremity. So what you have to remember when you have neck pain, give a therapist a call. Talk to them about their symptoms, what you feel, what you're experiencing, and they may be able to tell you whether or not we're helping you. Okay. Now, remember what we talked about the other day? We talked about breathing and how if you're getting that lateral expansion of your thoracic spine, you're doing it properly. If you're a chest breather, using all these muscles and all the muscles that attach up into the neck, that can restrict that good gliding movement of the bones. The neck muscles also attach up into the jaw. So if you guys have a history of jaw problems, that can be related as well. Yes, your neck can affect your jaw. Yeah. And a lot of people with jaw issues, they say like 90% of people with neck and jaw, they usually have corresponding jaw issues and vice versa. So if you have jaw issues, you typically have neck pain. And if you have neck pain, you typically have jaw issues. And that can be either like hypermobility of the jaw, meaning something moving too much, get a lot of clicking, cracking, grinding, or you can have tension and hypomobility. Hypo means not enough movement. So like a locked jaw or minimal movement upon opening, like if you go to the dentist, that sort of thing. So all these muscles in the upper neck are very interrelated to the jaw. So we can see, usually I'll always check the jaw when I do see somebody with an upper neck issue. And then if you do have neck issues, what we also need to talk about is headaches. Some people have migraines, headaches, posterior occipital headaches. And usually what we commonly see is a restriction, again, in that upper C-spine. I cannot tell you, I would say 80% of my neck patients have upper cervical spine dysfunction. And what I mean by dysfunction, it's just a fancy term for saying it's not moving properly. Nothing to be scared about. What we have to be careful in the physio profession is the words that we choose to use. I try to use symptomatic, restrictions, stiff, that sort of thing, because a lot of the stuff that we see is fixable. You just have to make sure that you find the right therapist to help you and guide you through the recovery process. Anybody have any questions about what we went over tonight? If you guys head over to our Instagram, usually we have a couple of posts on thoracic spine mobility, cervical spine mobility, stretches and things that you can do to help improve your range of motion. If you're unsure and you are experiencing a lot of pain, make sure that you do consult your doctor or a registered physio if you do have any questions before you try anything if you're unsure. But it does, understanding how your neck moves and what can affect it makes a huge impact on your recovery. So please make sure that you invest in yourself. If you are experiencing neck pain, if you are experiencing that radicular pain down the arm, feel free to reach out to me or one of our therapists, and we will be happy to let you know whether or not we can help you. And if you guys know anybody who does experience neck pain, feel free to share this to your page or share it to their page or tag them in the comment section so that hopefully we can give them some understanding and let them know whether or not we can help them. Now, if anybody doesn't have any questions, I am going to wrap up. So that was your workshop on learning about how your neck moves. Like I said, head over to our Instagram at fun_physio if you want to find out a little bit more about stretches and things that you can try at home to try and improve your mobility. Have a great night, guys, and we'll see you on Wednesday. And yes, Dad, we can do a session on jaw in itself if you would like. My dad's asking about jaw issues. Oh, thank you. I just got a really nice comment about the info. Well, Sagpreet, my whole goal with everybody is educating everybody on how things move. I find that the more people understand their body and how they move, they tend to recover a lot faster. So if you're interested in that low back seminar, check my listings on our Facebook page. I believe I'm doing low back in the next week or in the next 2 weeks. So be sure to follow that, and hopefully I can give you some education and some guidance. You're welcome. Everybody take care. Stay safe. Keep a smile on your face. Be patient. Be kind. Call somebody once a day. Work on deep breathing, be active, stay active, keep your kids active, and stay healthy.